Cellular adaptation. Now we will look about hypertrophy and hyperplasia. So this is how healthy cell looks, and in hypertrophy there is increase in the size, and in hyperplasia there is increase in the number of cell. Difference between hypertrophy and hyperplasia, which is important previous year question. In hypertrophy there is increase in size of the cell, whereas in hyperplasia there is increase in the number of cell. Mechanism: increase in the transcription factor like GATA for NEFT and MEF2. There is increase in the transcription which leads to more production of RNA, which further leads to increased translation leading to increased protein production. Whereas in case of hyperplasia, there is increase in the number which occurs by mitosis, which is induced by growth factor. Now examples: in gravid uterus, which means normal fetus in pregnancy, there is hypertrophy as well as hyperplasia, but hypertrophy is more common. In breast, puberty and pregnancy, there is hypertrophy as well as hyperplasia, but here hyperplasia is more common, so remember it by mnemonic P for P. So hyperplasia is more common in puberty and pregnancy. Now examples of hypertrophy. First is in bodybuilders there is hypertrophy of skeletal muscle. Then in case of obstruction, like in urinary bladder obstruction due to stone, there is hypertrophy of the tissue proximal to the obstruction, and also in case of cancer of intestine there is hypertrophy proximal to the level of tumor. In case of aortic stenosis, there is left ventricular hypertrophy. Now let's see the examples of hyperplasia. So in case of postmenopausal women and in case of females suffering from ovarian tumor, there are chances of granulosa cell tumor, which leads to increased production of estrogen, which leads to endometrial hyperplasia, which increases the risk of endometrial cancer type 1. In case of male, there is benign prostatic hyperplasia, which is now referred as nodular hyperplasia of prostate. So when the testosterone is converted into dihydrotestosterone by alpha reductase type 2 enzyme, there occurs hyperplasia. So in the treatment, fenestrase is used, which inhibits the 5-alpha reductase type 2 enzyme.